Welcome to Advanced Health session. This time is a special time. We don't have an audience like what we have done in the past sessions of Advanced Health. For those who don't know, Advanced Health is a multi-stakeholder engagement platform in collaboration with Connect Communications and Synapse, along with Dubai Science Park. Today is a special session for Advanced Health. We are doing it digitally and online. We want to reach as much people as possible. And the topic for today is coronavirus. With me, I have Dr. Fatma bin Shabib from Dubai Health Authority, Dr. Emmanuel Monsieur from the Mohammed bin Rashid School of Government, and Dr. Wael Al-Amin from King's College Hospital in Dubai. I'd like to start with you, Dr. Fatma, and recently we've been hearing about social distancing and isolation. Very recently, last night with mosques, and with schools to begin with. So why is that important, and how can that be a means of reducing the spread of the disease?
As we've seen across the world, where the virus has started in China and moved on, therefore, across the world, we can see that the growth rate of the spread of infection is quite high. So there's an exponential growth in the infection of the disease. So therefore, when the country is implementing all those bans, starting from the schools and going forward ahead till it reached the mosques and prayer areas, temples and churches and so forth, by doing this, we are decreasing the exposure of people to the virus itself. Like if you were a normal person, healthy individual, the symptoms of the disease would be very mild. But when we're doing this and we're decreasing the spread, we are protecting our vulnerable group. And by protecting the vulnerable group, those who are immune compromised, the elderly, the senior citizens, who have a cardiovascular disease like hypertension and diabetes and so on, those are the vulnerable groups, and those are the ones that we're trying to protect. Mm-hmm. So by doing this, we're decreasing the exposure of the virus from the healthy ones to the vulnerable group.
And is it true that if you're an individual below the age of 35 and you're healthy, you shouldn't care at all, you shouldn't wear masks, you shouldn't sanitize, or is that a misperception?
That is a complete misconception, because you are still a carrier. So far, the research shows that the course of the virus is not very clear yet. Some people are asymptomatic. Some people are getting a mild upper respiratory tract infection like sneezing, coughing, runny nose, and so on. And some people are actually developing more serious complications where they will require critical care. And therefore, if you are a healthy individual, you definitely need to sanitize, definitely need to take the extreme measures in droplet infections, and not just to protect yourself, but as well to prevent yourself from carrying the virus from one person to the other.
Correct. So you could be healthy, but carry the virus and go to an unhealthy or an elderly and have them infected. Dr. Emmanuel, what's so special about this virus?
COVID-19 it's a fairly new virus that came into this sphere, and lately the WHO, the World Health Organization, categorized it as being a pandemic. Now, why is it so unique? Some of us may not know the corona word itself stems from the original word as crown. At the top of the virus, there is a symbol that represents the crown. Now, it's important for us to understand that research has not been complete in terms of understanding exactly how this virus is being transmitted, whether it's airborne or whether it's through droplets as well. Okay. So what makes it very unique for us is to be preventative, to be much more protective in terms of sanitizing ourselves, being cautious of sneezing and coughing around others. And if you're ill, you stay at home. For instance, the UAE government has implemented many measures. I was looking at it last night, for instance, over 32 different measures. A few to mention is one is promoting more social distancing. And to add to Dr. Fatma's points, last night there was a report that was released from the Washington Post, where it simulated an exercise looking at four main categories. One, allowing free-for-all access for everyone to roam and do whatever they're doing. And it simulated how the virus can be transmitted, how it can be prevented, and so on. In this case, the confirmed cases were at a much higher rate of contracting and transmitting. The second simulation attempted for quarantine at home, self-quarantine if they have traveled or if they suspect they may be in contact with the virus, which showed some sort of value in terms of lowering the risk of transmission. The third simulation for social distancing, it related more to moderate distancing, where it allowed for fewer cases of being transmitted. And then the final one was making sure it's extensive distancing, making sure for instance, the UAE mandated last night mosques should be closed. Also, churches has been sending out updates that, okay, the churches will be closed in the next couple of weeks as well. Large gatherings as weddings and so on has been cancelled.
Right.
So it is onto us to be much responsible in terms of understanding what's happening around us.
Much more mindful.
And to be much more mindful about this.
Great. Dr. Wael, if we look at the healthcare system and the infrastructure of Dubai and the UAE, do you think we're ready to be dealing with such an issue?
One can always express that we're in a very lucky sort of situation in comparison to other healthcare organizations that I've previously worked in that we have a younger population, first of all.
Right.
With a median age, I think, is 33. And if you take one standard deviation, we're looking at a range of 29 till 37, roughly, which in itself, although does not preclude them or exclude them from getting infected, it probably will reduce our need for intensive care beds. So the problem predominantly in other parts of the world is they have an elderly population that requires high capacity intensive care beds. You maybe have been following the news in the UK where they're asking car manufacturers to start producing ventilators. Because of the lack of capacity, because they have a much higher proportion of elderly persons as part of the population. Here,
that's generally the case in Europe.
That's generally the case in Europe, generally the case in Italy, and it's really important to highlight this and outline it. Each country has its own specific dynamics.
Correct.
So we cannot extrapolate what's happening in other countries to what's happening in this country. For instance, Saudi Arabia has a massive migration pattern that happens twice a year between Ramadan and in Hajj. So their picture is very different to the UAE. Yes. The UAE is a massive hub in terms of airline and air transport. So the picture again is very different. But to answer your question, do we have enough capacity in the hospitals to care for our population? We probably do. Okay. So the likelihood is yes, we do.
But I think what's important for people to know is that we should make sure that when we do need to go to the hospital, we go at the right time. And before going, we check with the family physician, or we check for symptoms that are actually declared on the internet and by the authorities, rather than putting unnecessary pressure on hospitals.
You're very spot on. Part of it is trying to control flow in hospitals, because we mustn't forget that we still have people coming to us with heart attacks. We still have ladies coming in to give birth. Right. We still have people who require urgent surgeries. We still need people to have their hip replacements. And what we do not want to do, and what we're doing our best at the moment, is to keep the flow going. It's an unusual time and circumstances. Many people wouldn't have witnessed such surge. The last one we had would have been the H1N1 in 2009, but this region was fortunate enough not to go through it as bad as other places. So what's really important is for each and every single individual to carry the responsibility and to assess their own individual risks. So again, it's really important to assess your own risk. What is my risk of getting the disease? What is my risk of getting severe disease? And what is my risk of spreading the disease to someone who really shouldn't get it? Right. So what we shouldn't be, it wouldn't be nice to get it, but we have to be logical about our individual risks. And the model I just always use to explain to people is car accidents. So far, we've had about, at least in the first 3 months, we had about 3,600 deaths from coronavirus. At the same time, we had 360,000 deaths, because that's the final outcome we're looking at the moment, from car accidents worldwide. So that's, the ratio is 1 to 100.
Right.
So your individual risk from a car accident might actually be much more
Than the coronavirus.
your fatality, individual fatality, if that's the absolute outcome we're looking at, is about 100 times in dying in a car accident than dying from coronavirus at the moment. So this is the current statistic.
I think this is, the right time to be making use of technologies that we already have, like telemedicine, like, apps and devices that are widely available, and people just need to use them with the right guidelines that are already issued by the authorities. Dr. Fatma, we've been hearing about the flattening curve. Tell us about that, and how would you explain that to an individual who knows not much about it?
Flattening the curve basically means that we're reducing the load on our healthcare system. We are trying to get as Dr. Wael as well said, the infection rate is high. Probably 60-70% of the population would get at the end infected by the coronavirus. But the whole idea is we don't get load on the healthcare system in a very short time. So by flattening the curve, we are ensuring that everyone will get access to care. So people who need the care will need it at the right time. So this is basically all what it means.
Okay. Dr. Emmanuel, in terms of policy, and today we're talking about the coronavirus. A few years before it was SARS, H1N1, and probably there will be another one in the future. So what sort of policy measures can we implement today that will make us more ready for such things in the future?
The World Health Organization has mandated for its member states, the 193 countries, to be involved in setting up their national health security plan, action plan, in cases as such, for dealing with such outbreaks and pandemics that has been classified. Now, it's important for the UAE in specific to harness on these guidelines and to build strategies and put measures in place for dealing with such crisis that we're currently being placed. Luckily for us, there has been a committee that was put together by the DHA in collaboration with the Ministry of Health and Prevention a couple of years ago in planning for dealing with health crisis for the Expo 2020.
Okay.
Knowing that there's going to be approximately 20 million people coming in during the 6 months, how to manage contagious diseases and infections and so on. It has been preempted, luckily for us, in the sense that we were ready as a country to push this forward. It's important for policymakers to ensure that these policies are working. And as a School of Government, we teach public policy. We teach how to devise and to develop public policy. But at a time as this, we need to make sure and involve all stakeholders. In most times, policies are made just having a specific group of persons working on these policies. This, as we can see, the COVID-19 is something that affects everyone across the planet, right? This is not, and as you've rightfully said, it won't be the last virus to hit us. We have to be collaborative across all board, looking at citizens' inputs, looking at patients, looking at, of course, the different stakeholders to be involved, the municipalities, the health authorities, the ministries of health, even food, salons, and so on. Everyone needs to come together in putting these policies to play, because it affects not one person, it affects all of us as a country.
Course. Dr. Wael, we've been hearing the famous 27 degrees, that if the temperature is higher than 27, then the virus should disappear. Is that, how true is that?
I think at times like this, the worst thing one can say is spread non-scientifically proven theories.
Right.
It's not proven. We don't have a clue.
Okay.
Is the honest answer.
Okay.
Whether temperature will change it or not. It's spreading in temperate regions, both extremes, hot and cold. What we should concentrate on is what we know.
Okay.
What we know is the virus can spread from person to person via droplet contamination. And that's what we know. And what we know is pandemics throughout history have always changed history. From biblical times, if you look at any religious scriptures, if you look at historical books, if you even look at the cave markings, there's always been evidence of pandemics changing history.
Correct.
This is not going to be any different. We are very lucky. We live in a town where we have better communication skills, we have better isolation facilities, we have better information, we have more hospital care. It's less likely to be as severe as the last great pandemic of the 1918. But it's and what's really important is rather than focus on these hypothetical situations, is to focus on people's mental health. We have a lot of experts working 24/7. I've been bothering Fatima here by emails day and night, trying to sort of reach whenever we have a situation. There are people working in the background. And what do we need from people is the real question. Leave these questions for the people who are meant to answer them. And if we do come to an answer, there's no vested interest in letting the people know if it is the right answer, if temperature would help, if, I don't know, garlic will help, something like that. We have no vested interest in saying that it does or doesn't.
Right.
Until you hear a definite answer from an authority, such as all we expect from people is to just adhere one source of information and actually take good care of their own mental health. This bombardment of information from the social medias, whichever one you're using, is scary. And fear is an inherent saving sort of behavior for us as humans. It saved us.
Yes.
But what we shouldn't do is abuse this.
Of course.
And if you abuse it, we're driving fear mongering. We have people hoarding in supermarkets unnecessarily so. You have to remember, if isolating yourself, but if your neighbor isn't doing the right thing, you can still get it.
Yeah.
So it doesn't work that way. Yeah. If you're full and satisfied and you have overflowing cupboards, and your neighbor is hungry, he may end up breaking your door.
Correct.
Yeah. That's the normal human behavior that happens.
Yeah.
So what really is important is for us as a public is to focus on where we're needed. As a public, let's just live as a community at a time of difficulty. It's not easy. And take good care of both our mental health, our neighbors, and stop this rumor spreading. It's really, really important, even for us in hospitals. It's overwhelming us. It's spreading panic is no good at all. And I think this is the bit that we need from the public more so than anything else. There are experts. There's a massive, massive collaborative project. It's one of the biggest ever in history recorded. People from the west to the east collaborating science. We had the genome sequence in 2 weeks shared between countries. None of this nonsense of patenting.
Right.
Tests were produced in China, gone to Italy, gone to the US, come to us here. And people are collaborating 24/7.
I think it's important to be using all channels to be spreading the right news, and for people not to panic, and always to refer to the one approved authority for information.
Correct.
I want to shed a little bit light on the therapeutic side and on the pharmaceuticals. What is happening in that world? I know there is fast track basically on some of the pharmaceutical companies in the US that are trying to produce vaccines. Do you think they will be basically solving the problem, or it's more of a collaborative approach that will help us go through this?
It will be a collaborative approach. Vaccine production is definitely one of the best bets in spreading an infectious agent. We had this done from the 1940s and 1950s, mass immunization. It's worked for quite a few things, including measles, mumps, rubella, polio. Polio eradication is nearly done, smallpox.
Yeah.
But we need to go through phases, what they call trial phases. You have a phase 1 trial, first of all, assure that it's not dangerous.
The efficacy and the safety.
Exactly. Is it going to kill the person, or is it going to kill the virus? That's the first question.
Correct.
Or protect from the virus rather than kill it. The next phase would be, does it really work or does it not really work? Yeah. Is it better than a blinded? But yes, there are vaccines. It will take a minimum of a year to 18 months. I wouldn't see it coming before that. With regards to the vaccine drug development, there are already drugs in the market. There was a big trial happening in Saudi Arabia, led by our colleague Dr. Ziad Mimish in Saudi Arabia for the MERS virus, which is a similar sort of group of viruses, predominantly using antiretroviral drugs in combinations with immune suppressive therapy. It shows some promising results. They've trialed it in China, some of them, these combinations, that we are currently registering people for trials should they fulfill the criteria to start them on these treatments for us to understand, and it goes through rigorous scientific selection, like any other drug that comes into the market.
Right. Dr. Fatma, if there is one thing you would tell the public, what would you tell them?
Definitely adopt self-isolation measures and adopt self-isolation behavior, and make sure that, as Dr. Wa'il said, you're not overusing the market or overusing the services or abusing even the groceries in the grocery store. Just take whatever you need. Things will be fine. It's just a 2-week phase that we're going through, and it's gonna
People
pass.
shouldn't panic and stop for months.
No. It's just a behavior that we need people to adopt. They should just be at home, sit at home, and avoid social interactions.
Right. Dr. Wa'il, we've been hearing about how the virus stays, whether it stays in the air or on surfaces. What's right? People seem not to be clear on what's true.
The virus at the moment is still droplet. Airbornes have a completely different definition. An airborne droplet is predominantly, when we talk about that, it's healthcare organizations where we divide them as such to airborne and droplet. But generally speaking, the virus does not hang in the air.
Okay.
Yeah. Once someone sneezes, coughs, it lands with whatever body fluid that comes on to the surface, and there is reason to that. Most viruses are actually droplet.
And how long would it stay on a surface?
So the best evidence we have so far is from a paper just published last week from John Otter from Imperial College in the BMJ. However, so they're talking about, so we're talking about a half-life of about 12 hours, which means that until it disappears, we're looking at 36 to 48 hours in overall from the surface. But there's a caveat to that. And it's a very important caveat, is when they look for these viruses, we look for the RNA, for the genetic code of the virus. A living virus, so usually it's not necessarily that if you find the genetic code that the virus itself is able to replicate.
Okay.
So these are two things. So they were able to find the genetic code on the surface, not having disintegrated for a half-time of about 12 to 18 hours, ranging depending on the type of surface, whether it's wood, whether it's plastic, etc. But we really, even that sort of data is still preliminary because you have to culture the virus to see, and there's something called the Cox hypothesis that you have to fulfill. Is it still alive? Is it still viable? And does it still cause infectivity? So these experiments have not yet been carried out.
Okay.
So just finding even in patients, even when we say 14 days, 18 days, 21 days, we're only looking for the genetic code. And a lot of the times after the first 5-6 days, in particular in the patients we've seen, the virus may still be there, and we may test it for a further 28 days, but that does not necessarily mean it's still replicating or viable.
Okay.
However, we take all precautions with the assumption that it is. We can only assume that it is infective, although these experiments will be done. We don't have the time to do them now, but they will be done, and they're probably being done in other places at the moment.
Okay, excellent. Dr. Emmanuel, there is lots of information out there, whether it's on social media, on the TV, on the internet. How do we manage things at this point, at this really critical times?
Indeed, there's a lot of information, and given the age that we live in, we literally have the information on our fingertips.
Correct.
Now, it's very important for us. We've seen, so I'm originally from Trinidad and Tobago, and we've witnessed cases where when we just finished a season of Carnival, where there's been thousands of people that comes in for this festival.
Yeah.
Now, there were lots of misinformation that caused a lot of panic within the country and excessive shopping and buying, fights as well in the supermarket. And we've seen it in Australia, we've seen it in Geneva, all over the place. Now, it is important for the individual to always validate information. It is important for them to go to the original sources. The same way that you want to click forward, just take a second to just check and validate this information. For instance, yesterday I received a notice from on WhatsApp saying that all restaurants and bars will be closed. A letter from the Dubai Tourism. I have a contact in the Dubai Tourism. I messaged her. I said, could you just confirm if this is true? It just takes a split of a second to do this.
Right.
It's important for us as citizens to be responsible in taking ownership of this before spreading misinformation. Because this caused a lot of panic. It caused a lot of panic buying, excessive unnecessary measures taking place. For instance, and no offense to anyone wearing masks in here, for instance, the wearing of masks it's recommended for those persons who are currently experiencing respiratory symptoms.
Okay.
COVID-19 is not the only virus right now.
Yes.
We have influenza. It's the season of respiratory viruses.
Correct.
It's that season.
Correct.
This is not the only thing that's happening. So we do have other things that are happening simultaneously. So if the person is experiencing such symptoms, whether COVID or not, and you're not sure, okay, fine, you wear this mask
To protect the
to
others.
protect the others. Also, if you're caring for someone who has some sort of respiratory symptoms, you may want to wear such masks. This is a common myth. Like a few weeks ago, which I just returned from Amman a few weeks ago, attending a WHO meeting on health, on social determinants of health for the Middle East, which I have myself has been self-quarantined for the last 16, 17 days. This is my 17th day. I would say luckily, working from home policy stepped in as an educational institute, as a university.
Yes.
We have transformed all of our teachings, meetings, everything has been done online. So it's worked in my favor. So it's on that point, it's important for the citizens themselves to take ownership of self-quarantine. As Dr. Fatma said and Dr. Wales said, you know, it is our responsibility. We alone knows what happens in our personal life. For instance, we have friends that are traveling regularly.
Sure.
They may not disclose that his or her partners or spouses are traveling. So it must be on to that person to be socially responsible, to stay at home, be within the confinements of their home to contain the disease, to contain this virus as a whole. So
Excellent,
thank you.
excellent. Very good. I'd like to thank each and every one of you for your really valuable input. This is, you know, a time that we're going through, and I think exchanging such information between ourselves and also to the audience and the wider audience is important, so that people do not panic, take the right decision, and also inform, you know, their loved ones. So thank you again very much, and I wish you all the best.
Thank you.
Thank you.